Hello, and welcome to a very special segment of the Smile Now podcast where we are doing Ask the Expert. I'm joined here with Dr. Caleb Stott, my partner here at Smile Now. Dr. Stott, thanks for joining me.
I'm really excited to be able to do this, and I think it's going to be really beneficial for people that are looking to do these treatments and looking to somebody that can help them out. Most of these questions come from all over the internet, so part of our job is to be aware of what patients are thinking and what they're feeling and everything like that. And looking online is one of the best ways to really understand what kind of information they're looking for. I thought this one was really good. Does dental torque test hurt? Mine is Friday.
All right, that's a good one. Yeah, what do you got?
Yeah. Right. So when we're talking about a dental torque test, what we're doing is we're looking at implants after the initial integration phase to see if the bone attached to the surface of the titanium, right? A torque test literally means what it says. Like, you apply a certain amount of torque, we measure it in Newton centimeters, and implants, if integrated into the bone, have very high torque values. If they have not integrated into the bone, then you'll get some slippage of the implant, or you'll cause a little bit of discomfort. So does a torque test hurt? The answer is yes and no, right? It doesn't hurt if everything's healed correctly. It does hurt if it hasn't healed correctly, and it's one of the more accurate ways that we can assess osseointegration, or the attachment of bone cells to the surface of the titanium implant. What do you think? What do you think about that?
No, I mean, that's exactly right. One thing I will say about it is sometimes it can hurt just slightly, even if the implant is okay. So let's say we're talking about full arch, right? And so a lot of times in full arch, what you have and what you can actually see above your gums if your teeth get removed is something called a multi-unit abutment. So basically that's just an interface between the teeth themselves and the implant that's in your bone. And this is kind of just like it's a bridge between the two. And there's a screw that goes into that has to be torqued down. So usually if you're getting full arch treatment, we're not actually torquing the implant directly. We're torquing the multi-unit, which is screwed into the implant. So one thing that can happen is throughout the process is when we are doing your surgery, we put the multi-unit on and we torque it at a certain number. And then we're going to screw the teeth in at the end of the day. You're going to wait, approximately 3 months or so. Usually with Smile Now, we're around 10 weeks. And we'll go in and we need to now retighten that multi-unit to make sure it's nice and tight. And it's going to be tight, once you get your finals, and it's going to stay tight forever, right? Well, sometimes that multi-unit throughout the process of your healing, it might come just a little bit loose. And so when that happens, the multi-unit now, it moves around a little bit. That can cause a little localized inflammation and potentially pain. Sometimes you won't even notice it while you have your teeth in, but when we go to screw that back in, it's going to pinch on those gums a little bit and cause a little bit of discomfort. It's very different than if the implant had failed, because then things start moving and it hurts a little bit more. So that's one area where it can be a little bit irritating as we tighten that down, but rarely do I ever numb a patient up for this, because I want to know if there's something wrong. But in generally, it doesn't hurt. It's just sometimes there's a little bit of pressure as that kind of cinches back down the implant. So it's just something to be prepared for.
Yeah. I mean, you explained that perfectly, and I would have brought that up too had you not said it. And really, what happens is when you retighten these multi-unit abutments, these interfaces, it's the tissue. The tissue is connected to it, and then you compress the tissue and you feel that.
Sure.
Right? Is it some type of pain? No. After you do it once, you're not going to feel it again.
Yeah.
A couple other tests that I use, I know you use these too, is I use a percussion test, right? So I will just take something middle and I'll tap on the implant. And if it tings really loud, it's because there's good connection to the bone, right? I don't know what to compare this to, but like if you have something metal in the ground and you tap on it with something else that's metal, you're going to get very loud tinging percussion sound. If you put it in grass, like in soil, and then you tap on it, it's going to be thudded because it's not, because it's just not
right.
super.
The ground is like absorbing
that,
so there's not as much sound. Yeah, that's a good point. Yep. So this next one, a patient is asking, has anyone broken a zirconium bridge on implants? I have broken every temp I've ever been given, and I'm worried about the finals. So first of all, zirconium is the base element that a lot of these bridges are made out of. We make it into sort of like a ceramic, right? So it kind of resembles porcelain a little bit more. It's a lot more aesthetic. What we call it is then zirconia. That's technically what it's called, but zirconium is perfectly fine. Totally understand why that might be confusing. So this patient is concerned because they've been in their temporaries and they have broken their temporaries. Now they may have printed teeth as a temp. They may have some dentures that have been modified to screw into the implants. We don't really know that at this time. But one thing that I'll say is if a patient is repeatedly breaking things over time, let's say that first breakage, maybe that's just they weren't eating what they were supposed to. But generally, after a patient breaks a bridge, they get really careful about what they're eating. So that kind of, nullifies that because she says it's breaking multiple times. So the two things that come to mind for me are either the bite is not set up correctly and we have a little bit too much force on some, like maybe she's got a really strong bite and there's a lot of force on just one particular part of the bridge. So that may be a tooth setup problem. The other thing it could be is this patient may be a grinder. So this might be someone that grinds during the day. They're like clenching out of nervousness or some sort of subconscious tick, or at night, maybe they have sleep apnea. Maybe they just grind their teeth at night and they're just constantly gnashing these together and breaking their temps. One more thing that just came to mind is maybe the temps are really, really thin and maybe some issues have come about, but I want to give the dentist benefit of the doubt there. As for the first two things I mentioned, so when it comes to, biting down and grinding subconsciously, that's not really something we can fix with the teeth themselves. Rather, we can do things to make that effect get mitigated a little bit and prevent breakage. So one thing we do a lot in our offices is when we have someone that's breaking their temps, or they just maybe with their natural teeth, they were breaking those all the time because they were grinding, we'll actually use Botox to weaken the muscles right through here that are responsible for chewing together. And so by partially softening those muscles, we create a lot less force on the teeth and make them a lot less likely to break. Then when they do eventually get into their finals, a lot of times what we'll do is we'll actually substitute doing a total zirconium bar, and we'll actually use titanium as a substructure. So we use a metal that has a little bit of give to it. It's very strong, but it's capable of deforming instead of breaking like a porcelain would. And then we're putting the porcelain over the top of that to give it that same aesthetic feel. So there are things that can be done to mitigate this. And if this is something that's happening to you, you just want to make sure that your dentist understands why it's happening and has a plan for it. That's the most important thing. They don't necessarily need to be doing Botox. They don't necessarily need to be putting in you in some type of special deprogramming device or a CPAP or something like that, but they need to at least create an understanding around that, create a plan, and have something moving forward. Because if in that phase when you're having your temps are breaking all the time, that means there's probably something we need to think about before we go to the finals. Because even though zirconia is a whole lot stronger, if that same thing is happening, it's eventually going to break. Everything breaks and nothing's indestructible.
Yeah, you put it really well, and those are all the same things that I would have said also.
Mm-hmm.
Titanium at a thinner amount of material is as strong as zirconia, but it needs a thicker amount of material to be as strong. So I would go to the titanium bar. I also would say that the number one issue with these surgeries often is under reduction,
Sure.
right? So when you don't put the bone in the right place, then you don't have enough material to have the remaining teeth be as strong as they can. And the thinner material is, the weaker it is. Now, I would never compare zirconia to the plastic or the 3D printed resins that we use
Very
today.
different.
Like, yeah, a lot of people are being sold those as finals because they are FDA approved, the material for final teeth. However, it's just like a babysitting job. And even at twice the thickness, they're not as strong as zirconia or titanium. And so they're just not a lifetime type material. They're not a long-term material. They're something that definitely needs to be replaced.
Yeah,
so
absolutely. I couldn't agree more.
So this question, I thought this was a really good question too. Do you consider All-On-4 to be major surgery? I'm just curious what it is considered to be, because I'm starting to feel like it isn't considered a big deal.
Okay. Yeah. Good one. What do you got?
That's actually, I feel like this is one of the better questions
I like
I've
this one
seen.
a lot. Yeah.
Yes. So first of all, it is a major surgery for the majority of the people that do it. Okay, 100%. This is a surgery where we put you to sleep 100%. In our clinics, the majority of our patients are done under deep sedation. So we do nasal intubation with a CRNA or anesthesiologist. And then after we do that, we still are getting them numb. We're removing all their teeth. We're exposing their bone. We're getting out the infections out of their bone. We're replacing bone if necessary. And then we're placing implants. Like I said, we like to do anywhere from 4 to 6 implants. Then after that, we're kind of like reapproximating everything so that it can heal. And then we're making a set of teeth for them that same exact day, right? Is that a major deal for some people? Yeah, definitely. For most people, I would say yes. And what you can expect is for the next 2 to 3 days, feeling like you just had surgery.
Mm-hmm.
Now, I remember my first surgery was actually my finger. You can hear it popping. But I was playing flag football and I went to go pull a flag and I dislocated my finger and broke it. And so I had to go in and get 2 pins put in my finger. And this is when I was like 20 years old.
Yeah.
Well, I was really excited to do surgery because I had never done surgery before. And I remember coming out of surgery and feeling like it was the worst experience I had ever had. Just like drowsy, droopy, lots of pain, uncomfortable. And this is very similar in those regards. You will see a lot of videos online of people like seeing their teeth, and some people do really great and they see their teeth. Usually is that like immediately right after surgery? Typically no. But usually it's like a couple days down the line or something like that when they're feeling a lot better. So
Yeah. Yeah, I think that, the term major surgery is kind of subjective, right? And it's
yeah,
different depending on how you perceive major surgery to be. It's also kind of different depending on the patient themselves, right? So, like, if someone's relatively healthy and they don't have a lot of, we call them comorbidities like uncontrolled diabetes or hypertension or a recent heart attack or something like that, then, they can recover from this in a very uncomplicated way. A lot of times people don't have a whole lot of pain after their procedure. And, to them, it might be a little bit more minor. However, if someone does have a whole lot of things going on in their body that we have to be aware of and be very careful of when we're doing it, you can consider the surgery to be a little bit more major for that person. But as far as the sedation is concerned, it's really important that you be super comfortable throughout the procedure. We don't really want you remembering anything. We don't want you moving around or anything, so we can do the best work. But at the same time, it's not the type of sedation that you're going to get if you're having a heart transplant, right? So when you go into the hospital and you're getting sedated, yes, that is a deep sedation as well, but they're also paralyzing your muscles. They're like completely paralyzing your body, and then they have to, get you to come back out of that. They have to use drugs to reverse you out of that. In our situation, we do get you at least on a conscious level to a similar place because you're not going to remember or feel anything, but we just stop the drugs. We stop the drip, and then you wake up naturally. So it's inherently a little bit lighter than that, even though it's technically still considered deep or general anesthesia. It's more about your comfort than it is like completely immobilizing your body or something like that. So there's some nuances there. The reason we do it is because we know we can perform our best work that way, and we can assure the best patient experience and safety on top of that. But it's kind of hard for us to consider it major surgery when we can do this in an hour and a half, 2 hours, because we've made it so simple and we do it day in and day out, right? So it's all very subjective. Yes, it's not the same as just going in and getting a single tooth pulled. But if you're going to somebody that really knows what they're doing and makes the whole thing smooth, it may not seem quite so major.
yeah, that's well said. So the nuance is definitely there. I've had patients the next day come and show up at the office and being like, "Dude, doc, I feel awesome. I feel better than I have in 20
All
years."
the time. All the time.
I've had people that had other issues going on, and like 10 days later, they're still feeling it
Yep.
pretty heavily.
Yep.
And like in between that is where most patients are. I would say 2 to 3 days. But overall, like nobody regrets this after they get it done. Like nobody has issues afterwards. Everyone loves the benefits of it much more than kind of the fear of like whether or not it's a major surgery. So
Totally.
it is really difficult to get all the information, get really good information. And that's why I'm glad we're doing these segments for patients primarily, is to help them. And I hope that when they see this, if they have any specific questions, they just drop it down in the comments for us. If you want to send us x-rays, if you want to like kind of get like a second look on something, we'd be happy to put that on these segments and kind of speak to you directly if that's beneficial to you.